Kohnen, licensed marriage and family therapist at Grow Through Life Counseling. I'm the clinical director with 2 locations in San Diego County and Eastlake and Del Mar. And just doing a series on how to prevent suicidal actions from taking place in younger populations. So we just talked through the protective factors, and now we're going to talk about preventative factors, so things that you can do with the youth in your life to help them out. Interact with them positively, give them a lot of positive feedback, give them compliments, increase positive activities, so include them, clubs, sports, connection to groups we know helps. Encourage them to go to their school functions, dances, pep rallies. Connection to other people is a great preventative factor. Appropriately monitor your teen's whereabouts and communication. So in this state, parents who supply cell phones to their teenagers are liable for the content that is viewed and shared on that phone. So keeping in touch with what's going on your teen's phone, be it textbook, Facebook, Twitter, Snapchat, Instagram, probably the cooler apps that I don't even know about yet, even though I try to keep up, with the goal of promoting safety. So sometimes teens push back, saying that they want their privacy, but really the liability for what's on that device falls to the parent, both legally and morally, who is supplying that phone. And so we typically encourage parents to keep a close eye on those things and monitor for any risk factors. Another thing you can do that would help be preventative is to monitor your teen's social environment. So who are they friends with? What kind of culture is it? If they are on a team, is it a positive team, or is there a lot of criticism or negativity on that team? How are the coaches communicating? How are the teachers communicating? And then talk with other parents in the community. Get parental connection going on. The more the parents are connected and looped in, the more we can prevent serious behaviors. We also want to communicate regularly with teachers at school to make sure that there's safety at school, or to identify any behavioral problems. Obviously, we want to be careful about limiting access to your child being home alone with access to alcohol, any prescription drugs, illegal drugs, knives, guns. If you can, keep those locked up and out of reach. Talk with your teen about your concerns. Ask him or her directly about any suicidal thoughts. Explain the value of therapy and medication that can manage symptoms and decrease depression and depressive thoughts. Address concerns with other adults. So if you are having some serious concerns about your child's mood, definitely talk with teachers, coaches, other people that can help you keep an eye out. And discuss concerns with the pediatricians, physicians, psychiatrists, all of the healthcare providers, and sign releases so that there can be some treatment coordination going on between the therapist and the medical staff. And we always try to do our part here to outreach anybody else who's working with this child to make sure we're all on the same page. So that is kind of a summary of the preventative factors. These are proactive things we want you to do if you're concerned about a child who may be, or a teenager who may be experiencing severe depression or suicidality. Thanks, and we'll continue in the next video.